My name's Bill Faubion. I'm a gastroenterologist here at Mayo Clinic. I specialize both in pediatric and adult inflammatory bowel disease, and we see, between both clinics combined, we probably see 4,000 patient visits per year with these conditions. Many times when families come to the clinic, one of the very first things we discuss is what are these diseases. So inflammatory bowel disease is really a term that encompasses two different diseases. One is a disease that affects primarily the large intestine that we would call ulcerative colitis. The other is a disease that can affect anywhere in the GI tract, all the way from the end of the GI tract, down by the rectum or the anus, all the way up even to the mouth. The disease is common. It affects maybe as many as 1 in 2,000 individuals. About 1 in 5 of any population with inflammatory bowel disease tends to be that of young onset, so children develop this condition as well. The peak age that a child might develop one of these diseases would be somewhere between the ages of 12 and 14 would be the peak probably, but we see children really down to very young ages, less than 5, that's uncommon, but less than 5, and then obviously all the way up through adulthood. By the time somebody's gotten here, they either have fairly extensive symptoms, which we'll discuss in a moment, or they've been referred and actually have established the disease. Many families want to know if they have, for example, siblings of children that are affected. They say, well, what should I be watching for? What types of things should I be watching for? So when people present with this condition, they can present with abdominal pain, they can present with diarrhea, they can present with even blood in the bowel motions, or more commonly, particularly in young patients, they may just present with falling off the growth curve. So they're not gaining height linearly and they're not gaining weight. And that might alert the pediatrician or the family physician to start looking into some of these gastrointestinal disorders, of which Crohn's disease and ulcerative colitis are two. Fortunately, we've got a lot of different ways that we can help families understand the extent of their disease and also understand what the best treatment modalities might be. As far as diagnostics, most people, again, are fairly familiar with a way we would be able to diagnose the condition. I think that there are suggestions in blood work. There are suggestions on certain types of x-rays. We do a lot of a non-radiation form of imaging in children called MR. It's what athletes say get on their shoulders or their knees. But the group here, our radiology colleagues here, have really optimized methodology to use MR in young people to look at small bowel and large bowel inflammation. Many other tertiary care sites or big hospitals also have involved this technology. So we do a lot of imaging and we can tell sort of where the disease is and how much bowel might be at risk. And then we also do endoscopy. So this would be the passage of a small lighted tube up from either from below, from the bottom, or even through the mouth, and then taking a look for evidence of Crohn's disease or ulcerative colitis in the intestine.